My name is Deighan. I'm an OBGYN at Southeast Georgia Health System in Brunswick. As an OBGYN, I take care of women of pretty much all age groups, kind of broken down into people that are interested in becoming pregnant or postpartum, but also gynecologic needs, benign GYN. So I also did an extra year of training after my residency in minimally invasive gynecologic surgery with a specialty in advanced robotics and laparoscopy. I chose OBGYN for many different reasons, but kind of the number one reason is the patient-doctor relationship. So we as OBGYNs have a really unique opportunity to take care of patients potentially throughout their entire lives. So early in their lives, before they even think about becoming pregnant, but then when they potentially become pregnant, we can take care of them throughout that entire experience. We get to deliver their babies, which is oftentimes the most special day of their entire life. And then we also get to take care of them afterwards. So whether they have future pregnancies, we get to deliver those babies and take care of them, or if they don't, we can move on to as women go through the next stage of their life. And if God willing, you take care of someone for 20, 30, 40 years, and it's just such a unique and special relationship that we get to have with our patients. I try to do everything with the patient-centered focus. So as opposed to treating the disease process, I try to treat the patient. So it may look like some people have kind of the same thing going on, but they may require different kind of avenues to kind of help better their lives. So for example, if someone I think may benefit from surgery, but they are absolutely not interested in surgery, well, that's fine. Let's think of something else. Or vice versa, so not every medicine necessarily works best for every person. So it's really kind of just basing it down on what we can do for each person individually. I'm from kind of the middle Georgia, and I went to school in Medical College of Georgia in Augusta, and then about 20 of us in my class actually did a lot of our training down in the Savannah, Brunswick area. So I was actually able to come to this hospital 6 to 7 years ago to kind of meet everyone and also learn how things were done here. Interestingly, I ended up dating one of my classmates that came down here, and fast forward 7 years, we're now married and we have a beautiful daughter. And so I got to meet the people here, but also got to experience the area, and I found it to be a really exciting place to raise a family. I really love to be outdoors. So one thing that I really was into back where I was in South Carolina, we lived close to some mountains, so we would do a lot of hiking out there. Now obviously we don't have mountains here, but we have the ocean and rivers and things like that. So I really am excited to kind of be outside and be on the water as much as I can. I'm really going to try and do what's best for you and your family and your goals of care. Whatever that takes, whether it's starting medicines or procedures or how we're going to manage this pregnancy, I'm always going to try and do what's best for you and your family.